Casey here from MBS Pro. I'm just showing you off part 2 in the video series of our clinic portal tools. So these are tools that are for the clinic as a whole as opposed to AI Scribe. Part 1, we went through the log on process and filling out your details for your clinic. This part, I'll show you how to do the integration. We'll have a look at the document scanner as well. So the BP integration is really important. In the context of the document scanner, it allows us to send files such as email, scanned documents, hard copy documents, faxes, etc. into your patient's email file, your doctor's inbox, your patient's BP file, not email file, patient's file, and BP inbox, just straight into best practice. So it's a very automated and convenient way of sorting things. Likewise, in the context of the AI receptionist, we can see your diary so that we can, obviously book patients into unfilled slots, etc. But this video, I'm just going to concentrate on the document scanner. So the first thing you'll need to do is do the BP integration. You can go to settings, BP integration, put in your site ID, that's your minor ID, plus the name exactly as it appears in your BP diary. It has to be exact, practice name, and then there'll be a button down here that says add integration. I've already integrated this one, of course, but you will click that button and it'll send an email to our team. We'll verify that you have integrated and you're the correct person to integrate, and then you'll be set to go. Now it takes maybe about 2 to 3 minutes to sort of initialize the integration through Halo, which is our third-party connector to BP. So give it 2 or 3 minutes, connects to your database, you can find your patients, etc. So let's have a quick little look at the document scanner or document sorter, either or. Essentially, this is an AI tool that sorts incoming emails, faxes, scans, hard copies of documentation that your patient brings in that you then scan in. The main way that we use it is actually via email. What that means is that each document scanner has a very specific email that's associated to your clinic. So you can see this is a good old test one. You'll get one that is, your clinic at mbspro.com.au. Email and forward documentation to this tool, which will then add the correct patient's name, details, the doctor that's coming from, so on and so forth. So we'll show you a few things like that right now. The other way that you can use it, of course, is you can just upload documents. So it accepts this type of documentation. You can just browse your computer and upload the files, of course, as well. So we mostly use email. Our scanner can email documentation. So if we get a whole heap of hard copy documents from patients, hospitals, referrers, etc., we can put it into our scanner, which then just auto emails once it's scanned in to this document scanner sorter, and then we can just go straight into BP from here. So it's a very, very quick and slick workflow. So here's some test patients. I've got Mr. Pan Peter. He's a test patient. We can see that he's got a pathology request form that's come through from James Patterson. This is going to myself as a GP. It's matched up name, date of birth, identifiers, etc. Found the right patient. The way it does it is by the magic of AI. You can see the fields that it's looked at by clicking there. You don't need to click anything if you don't want to. That's just sort of give you a bit of awareness of how it works. So to find all the details that when the documentation has come in, and then it'll assign it to a doctor, and then you can click to import it either to the inbox or the patient file. So it still requires a human to look through it quickly and then figure out where they want to put it, and then just go click import. It finds everything automatically and does that, but I would still recommend a human quickly using it as opposed to doing all the manual entry. So it saves a significant amount of time there. You can just go click, click, click and upload multiple documents and batch them all sort of at once. So I'll teach you about that. But would still recommend a human to use this, of course. So it's not 100% automated, it's 99%. That's a way that we can keep our documentation safe and secure. So a few other cool little features. You can also you can edit the documents that you're importing in bulk. So let's say that we wanted to call all these documents, test requested form or test requested. I'll just do that. We'll apply the changes. So this document now has test requested, and this documentation also has test requested. So we've edited them all at once. Now, this is provided that the AI doesn't figure out what the form is for in the first place. Of course, if the AI says, this is the form, this is the doctor that it's going to, this is where it's going, this is the patient, then you can just click import, and that saves a lot of time. But there's a lot of flexibility about how you use it, how you can sort through your documentation really quickly, and how you can pull it into BP. So we use this at my clinic at Connemara Medical Centre. Saves us a significant amount of admin time. Essentially, we're a pretty big clinic with 34 docs. We would essentially have one person just doing documentation for their whole entire job. Now that's been cut down to, a couple of hours, down from, sort of like a 30-hour week. So it's significantly quicker, easier, and a better workflow. And the other thing too is it's accurate. So a lot of manual entering can be, inaccurate, not because anyone's done a bad job, but if you're uploading 1,000 documents, a 1% error rate is 10 documents that have got the wrong name or details, etc. on them. Whereas with this, we can match up everything exactly and just reduce that error rate and reduce, the cognitive handling of all this documentation. So this is part 2. I'll do another video that goes over the AI receptionist. Make sure you check out our first video that goes through how to log on to this portal. All right. Thanks very much for that. Bye.